3% pay rise from June, with another 3% in August this year and again in August next year to cover the cost of living, as well as a one-off payment of $2,000. But the New Zealand Nurses Organisation spokesperson Cee Payne says the recommendations fall short of dealing with nurses' pay concerns. She's with me in the Wellington studio. Good morning.
Good morning, Susie.
Why is this not good enough?
Well, we were expecting to see from the panel a significant improvement in the recommendations around pay, and our members had previously rejected an offer of 2% over each of 3 years. We're now seeing a recommendation that obviously the DHBs will be considering around 3% over the 3 years, which is only an additional 1% per year. It doesn't address for us some of the key issues that we've already communicated around the previous offers, and that's we don't want money on as lump sums. We want to see the base of the nurses' salary scale significantly improved. We're a long way short of the teachers and pay parity, and the 3% in this year leaves us around 8% short still on teachers. So
sure,
it needs to be more.
But it isn't it more like 10% over two or 3 years, this one, in which case isn't that quite significant when you look at it that way?
Well, it's an improvement, as I say, of at least 1% per annum and a small additional amount on the lump sum. And
can't you have a separate conversation about raising the base rate of nurses' pay while accepting this at the same time?
Well, we'll be waiting to see what the DHBs offer. I mean, we're really commenting on the panel's recommendations. It's up to the DHB what they put on the table on Monday to our members, and that will determine the approach that we take to that position. Looking at the IPP recommendations, though, I know our members will be disappointed. They were certainly looking for a much more significant offer. We've not got any base increase for the first year of the term, which is nearly over now, and that was important for our members to reach that pay parity with teachers and not play catch up. I think, as a large female occupational group, women deserve to be paid fairly, and at the moment, nurses are paid significantly less than teachers, who we've had pay parity with in the past.
OK, so what would that mean in real terms? What amount of money does the nurses' base salary have to go up by, in your view?
Well, we've talked about those figures. Our teachers sit at about $73,300 already with a 3-year degree, no additional qualifications, automatic steps. Nurses are sitting at $66,500. That equates to around about an 11% increase if you were to address that gap now. And I think our members want to see it addressed now.
A lot of people will have sympathy for what you're saying, I'm sure. How much sympathy will they have if you go out and strike?
Well, at this stage, we haven't served notice of a strike. We're balloting our members. We'll have the outcome of that ballot on Monday. There's a lot of water to go under the bridge. Obviously, we will be waiting with anticipation to get the DHB offer to see what that does for our members. It's really important. I think the public understand this. We can have a good recommendation around staffing and and a commitment to increasing staffing equivalent to 2% of the nurses' budget. But if we don't have good pay, then we can't attract those nurses to come and work. So nurses are telling us that it's going to be still critical shortages, and in terms of patient care, we need nurses. And if we want quality public health care, we need nurses, and nurses need to want to come and work in the system. So
in short, you need to be bumped up over 70,000. You need also to have significant pay increases coming over forthcoming years. You also need more staff. Those are quite big asks to come all at once, but how hopeful are you, reading the tea leaves perhaps, that this may be something that the DHBs will come to the table on?
Well, I guess we'll wait and see. That's probably all we can do. They've got a lot to bear on their shoulders. We appreciate that there are costs, but nurses have been taking very low pay increases for quite some time now and been propping up the health system. And, the reality is that just can't continue. There's a crisis in staffing, and you can't fix that crisis without addressing the pay. And so the pay needs to be really clearly improved in a very short time frame.
This the possibility of strike action being floated coming in winter, of course, we know that is when hospitals and the health system do come under greater strain. would you be able to guarantee, if nurses did go on strike in winter, that lives would not be put at risk?
Well, we have already commenced discussions around life-preserving services with the DHBs. We've met with their national coordinator. We absolutely will comply with the Code of Good Faith and Health. We will ensure all our legal responsibilities are met. Nurses are required to provide life-preserving services. We're working through and we'll be approaching them around a national plan around that, and then local plans with each DHB.
Thank you very much for your time. Thanks for coming into the studio. Cee Payne there, spokesperson for the New Zealand Nurses Organisation. It's now 7:30.
Coming up before 8 on Morning Report, we speak to Jerry Brownlee about the tension in Parliament over the chairings of proceedings by the Labour MP and Speaker Trevor Mallard. International investigators say